Thank you for your attention. I am Nelly Nainggolan, resident oral medicine department from Universitas Padjadjaran. Now I want to present my case report about challenges in treatment oral medicine emergency during COVID-19 pandemic. Introduction. COVID-19 is an infectious disease caused by severe acute respiratory syndrome coronavirus 2, which was reported by WHO on December 2019. COVID-19 is a disease affecting the world and caused disruption in medical and dental care and made into a serious public health emergency in the world. This situation make limited access to health care, postpone and delay oral medicine care during COVID-19 pandemic, and may lead to serious consequences for oral and systemic health. Transmission of COVID-19 occurs mainly via droplet and airborne, which are closely related with dental practice and also with oral medicine specialists. Because oral medicine specialists manage acute and chronic oral mucosal disease, and some dental emergency in oral medicine can occur every time during pandemic and need immediately treatment. This case report aim is to describe several oral medicine emergency involving the oral mucosa handled during the COVID-19 pandemic, such as pemphigus vulgaris, erythema multiforme, uremic stomatitis, oral lichen planus, oral squamous cell carcinoma, and oropharyngeal candidiasis. Case 1. A 45-year-old male patient referred from Department of Dermatology and Venereal Disease Dr. Hasan Sadikin Hospital Bandung with the chief complaint of painful oral ulcer and difficulty in eating. The ulcer were arising 2 months before and the blister seen at the skin. Extraoral examination shows serosanguinous crust, tend to bleed with erosive and painful area present on lips and difficult when open the mouth. Intraoral examination show multiple diffuse erosive lesion on labial mucosa, buccal mucosa, and palate. A white plaque on dorsum of the tongue that can be wiped off without leaving an erythematous underlying mucosa. Patient treated with methylprednisolone, compressed the lip with sodium chloride, chlorhexidine dicleuconate, mouthwash, and folic acid, and patient get healing in 4 months of treatment. Case 2. A 57-year-old male complaining painful oral ulcer and eating difficulty for several days. Extraoral examination show hemorrhagic crust, tend to bleed with erosive and painful area present on lips. The patient could not open his mouth optimally. Intraoral examination shows ulcer, erythema, and erosion at the labial mucosa, buccal mucosa, and the dorsum of the tongue, and a white plaque on dorsum of the tongue and lateral tongue that can be scraped off, leaving an erythematous underlying mucosa. Patient diagnosed with herpes-associated erythema multiforme and oral candidiasis. He treated with prednisone 5 mg, nystatin oral suspension, acyclovir drug, compressed the lips with sodium chloride and folic acid. After 1 week treatment, crusting erythema and ulcer on the tongue and the lip has significantly improved. Case 3, patient with unhealing stomatitis on the tongue and almost several months. The ulcer getting worse and had suspicious for malignancy. Intraoral examination show a red and white ulceration with endophytic and exophytic lesion on the tongue with moderate pain. Patient treated with chlorhexidine dicleuconate and suggested to an MRI examination. The results show a suspicion of malignancy, and patient consulted to the oncology department. Case 4. A 31-year-old male complaining of a sore tongue when eating hot and spicy food, and white plaques on the tongue not healing for several months. He was afraid that unhealing sore tongue is a cancer. Intraoral examinations show a homogeneous white plaque that cannot be scraped off on the some of the tongue. There are bilateral white striae seen at the posterior buccal mucosa. Patient diagnosed with oral lichen planus. The patient treated with dexamethasone and folic acid, and after 2 weeks, white plaque get thickening and complaint of sore tongue has decreased. And now patient is still under treatment. Case 5. A 36-year-old male complaining of difficulty to open her mouth, feel not comfort and pain when eating for the past 6 days. Extraoral examination show exfoliative and sanguinous crust at the lips, an ulcer and white plaque on dorsum and lateral of the tongue that cannot be wiped off. Patient diagnosed with uremic stomatitis. Patient treated with chlorhexidine diclofenac mouthwash, and at the first follow-up after 2 days of treatment, the patient had slightly opened his mouth. Crusting of the lip also healing, and after the patient was instructed to continue this medication. Patient feel comfort when eating after 1 week of treatment. Case 6. A 35-year-old female complained of mild pain and difficulty in eating and swallowing since hospitalized. Intraoral examination show multiple white plaque on the tongue, gingiva, palatum, and pharynx that can be wiped off, leaving an erythematous underlying mucosa. And based on history and clinical examination, diagnosis was oral pharyngeal candidiasis. Patient treated with fluconazole and chlorhexidine diclofenac mouthwash and petroleum jelly. The symptoms reduction after 3 days of treatment. This is a table about case 1 until case 6. In case 1 and case 2, initial therapy aimed to avoid more serious complications because severe pain. In addition, the initial goal of treatment was to induce remission of the disease and reduce the pain. Prevention of sepsis because large area of aeration and ulceration. The treatment in case 3 and 4 are mainly to detect suspected malignancy and reduce moderate pain. The prognosis in oral mucosa is good only when the diagnosis is made early and the tumor is small. Cancer could be prevented by detecting potential malignant lesions and treating them. Dentists plays a pivotal role in early detection of oral cancer through opportunistic screening when a patient presents a dental practice for routine care and by rapid referral of suspicious lesion. Case 5 and 6 are referred from internal medicine Dr. Hasan Sadikin, Bandung, due to complaint mild pain and white plaques in oral and make patient difficult when eating and swallowing. Patient have systemic disease. The patient need evaluated and supported to restore intact food. Reduced nutritional intake can cause the patient's general condition to become increasingly decreased and can worsen the patient's systemic condition. When patient visit clinic, dentists must protect themselves comprehensively with highest level of personal protective equipment such as glove, gown, head cover, shoe cover, Google or face shield, higher level respirator, surgical mask, and particulate respirator. Good hand hygiene is one of the best ways to prevent the spread of infectious disease. Pre-procedural is needed and recommended to reduce the number of microba in the oral cavity. Evaluation the condition in intraoral patient can be used with telemedicine. Communication could occur with messaging applications such as WhatsApp, Telegram, Instagram, SMS, and messengers, and video calling applications such as Zoom, Google Meet, Skype, FaceTime, and WhatsApp. In this case, some of patients evaluated by phone consultation, WhatsApp, and sending clinical photograph. Conclusion: emergency patients should be treated. In treatment, we must use personal protective equipment. For a non-emergency patient, online consultation and sending photograph can be used to review the progress and condition of oral patient. Patient with recurrent acute condition, online follow-up, medication guidance, efficacy observation was necessary. Thank you.